Imagine a world where cancer treatments are tailored precisely to your genetic makeup, offering hope where there was once despair. Millions rely on effective medications to manage diseases like cancer and diabetes, but resistance to these therapies remains a significant challenge. Chronic myeloid leukemia, CML, is a blood cancer linked to a genetic mutation known as the Philadelphia chromosome, driving uncontrolled cell growth. CML is primarily treated with ABL1 inhibitors, targeting the malfunctioning enzyme, but resistance arises due to mutations in the ABL1 enzyme. These mutations alter the enzyme's structure, reducing the efficacy of the inhibitors and making treatment decisions even more challenging. Selecting the appropriate drug to combat resistance often involves trial and error, prolonging patient suffering and increasing treatment costs. Current approaches rely on measuring IC50 values, indicating the concentration of a drug required to inhibit enzyme activity by 50%. However, IC50 values vary between assays and are influenced by numerous factors, leading to inconsistencies and unreliable predictions. Recognizing these limitations, researchers have developed computational models to refine treatment selection for CML. These models evaluate the ABL1 enzyme's catalytic activity and inhibitor interactions to determine the most effective drugs for specific mutations. The approach emphasizes inhibitory reduction prowess, better predicting resistance than traditional methods. Professor Rand Friedman explains that their computer model helps identify which drugs work best for each individual patient. By focusing on how mutations influence drug binding and enzyme activity, the model pinpoints optimal treatment strategies. This method is valuable for patients who develop resistance after initial treatment, identifying alternative therapies more likely to succeed. Drug resistance complicates treatments for various cancers and infectious diseases, necessitating alternative treatments. Jennifer Sheehan emphasizes the importance of tailored treatments for those affected by chronic myelogenous leukemia. Insights from computational models could inform similar approaches for other cancers, expanding their impact beyond CML. CML treatments aim to achieve deep molecular responses, but resistance complicates long-term outcomes. Traditional drug selection methods compare IC50 values, but computational models offer a more accurate assessment of treatment options. These models integrate data on catalysis, inhibition, and pharmacokinetics, aligning with the goal of precision medicine. As these models evolve, they promise to transform cancer treatment, offering new hope to patients worldwide.